All right. I'm going to move on now to work that's going to be presented by Dr. Hibino from his own lab. The first author on this is Hiroshi Matsushita, and the title of the manuscript was Novel Reinforcement of Corrugated Nanofiber Tissue Engineered Vascular Graft to Prevent Aneurysm Formation for AV Shunts. And this was applied in an ovine model. It's from the section of cardiac surgery at the University of Chicago. Thank you so much for presenting today, Dr. Hibino.
Thanks so much for the opportunity to present our work entitled High Kink Resistance Nanofiber Tissue Engineered Vascular Graft in large animal model. So in tissue engineered vascular graft has been there for a while to overcome some problem of the currently commercially available vascular graft, and mainly to overcome the main issue for some stenosis occlusion at long term and also clot formation. And then tissue engineered graft can degrade over time because of this biodegradable material. Then the material itself will be replaced with a patient's own tissue, then which can create endothelial cell layer, smooth cell layer that is supposed to increase some patency and long-term durability of the graft. This study has been there for a long time, for decades. There are several still issues to apply in the clinical field. And especially in this study, we focused to two main issues we have right now for this graft. One is there are many biomaterial has been used to create tissue and vascular graft, but still most of the graft is really kind of rigid. So when you implant into some place and the space limited, like AV shunt is making some U-loop or like that, graft easy to make a kink, and that could be another reason of some difficulty to have patency. The other reason is this graft is still some problem for some mechanical property. So when we implant in the arterial side, very limited material can stay there for a long time. There is some tendency to create some aneurysm or dilation. If we use some strong material that have slow degradation, it can stay there, but those material can cause inflammation, it can cause stenosis. So mechanical property versus some degradation has been a problem. So in this study, we developed a corrugated tissue and vascular graft, which can prevent the kink. And we invented a specific method for reinforcement of the vascular graft. So here's an example of the explaining of our technology. So this graft itself is a PLCL nanofiber graft, which is one of the most popular nanofiber tissue and vascular graft, which has been studied for decades. With this graft, without having any corrugation, it's easy to kink. So we made a corrugation. We often see that this kind of corrugation in the background graft in the clinical used. In the nanofiber graft, it's sometimes difficult to create those things, but we developed some specific technology to create corrugation, and this gives us some kink resistance like this way. And then aligned with this corrugation, we put some specific suture. It can degrade or non-degrade the suture, can support this vascular graft. So in this way, this suture maintained there to prevent dilatation. And also at the same time, there is a space between the suture, which allowed some cells to infiltrate inside for tissue regeneration. So if caught with something in a very strong material outside, there may be some problems. But our hypothesis was when we create some coating with the suture, cell can infiltrate there and still can create a tissue. So we tested in vitro first and implanted in a sheep model. And then as an AV shunt, it's about 5 to 6 centimeters from this artery to venous, like a U shape. And this way we can test both the corrugation and the effect of corrugation reinforcement. So this is some first vitro study to test some corrugation. So without corrugation, these guys are rigid material, this PCL, PL series rigid. So it's easy to kink like this way. But with corrugation, we can dramatically decrease the kink radius. So the shape is like this way, even though we put this 180 degree and we can still maintain a patency. And then on top of that, we put some suture around there to reinforce this corrugated graft. So in this way, the tensile strength is going to be much higher with the sutures. Without suture around this here, but with this suture reinforcement, in vitro study, mechanical property was stronger. And then this PU group is a kind of other control. This is not suture, this is just a coated outside, just to compare. But with the suture has a bit higher mechanical strength. But when we put this suture around there, we checked again the kink resistance. But even though we have a suture around there, still have some kink resistance. So we were able to create this graft design in vitro model. Then we implanted into sheep model I just showed before, and followed up to the 3 months. And then this is a AB shunt. So the venous side is, of course, it's going to dilate over time with the flow from the artery side. This line here is a kind of acceptable range based on some previous study that could dilate this vascular graft itself because it's sitting between the artery and the vein. And then this square circle is jugular vein, which dilate over time. Carotid artery, this closer circle is still there. And the vascular graft is between there. We tested different materials. So when you look at here, this one is a control PU. This is just covered. But these are our new technology with the suture, just polypropylene, was stay there without dilatation. But when we use a different suture, more faster degradation like a PDO, which can dilate as a jugular vein, or without some any sutures, it can dilate as well. So the corrugation works well, and also, but at the same time, depend on some coating suture material. If you use some biodegradable, fast degradable material, or without coating suture, it can dilate. But with this polypropylene suture, can maintain a diameter and they still maintain a mechanical strength. This is a kind of busy slide, but we want to show is no matter what material we use, this is a nature of tissue graft. We can see endothelialization for all the tissues. And then we look at the carefully, depending on the materials. When we use this PU, just a coating to the outside, you can see there are not much tissue formation inside, especially in a high magnification here. There's a very coarse tissue. This is because this cover outside prevent stereo infiltration to the inside. But with our new technology here, just suture coating reinforcement, there is a space between the suture so the cell can infiltrate. So you can see that some small cell infiltration. And here, which can help some nail tissue formation. And with this configuration, this 2O suture, PDO suture, both as a good nail tissue formation. But as is shown before, if you use these PDO, 2O suture, both looks good in a tissue formation. But over time, this PDO suture degrade too fast, then dilate over time. But 2O suture with some reinforcement can maintain the diameter. So from these studies, our conclusion is that this 2O suture with reinforcement is a best way to register expansion and also to maintain a cell infiltration for tissue formation. So in conclusion, we are able to create nanofiber vascular graft with the kink resistance and also the tissue formation with some reinforcements with the suture. Thanks so much for the opportunity.
Wonderful presentation. Thank you, Dr. Hibino. All right. I don't see any questions. I did have some questions when I was reviewing this. There was, in your paper, you suggest that the patency was changed, although I wasn't totally clear on the effects of adding that suture and corrugation to the patency of the grafts. Can you discuss that a little bit?
Yeah, in this study, we did not implant kinked graft. So all grafts were implanted already corrugated graft. So we did not evaluate effect to the patency. But in vitro study, we already confirmed that it's really weak for the kink resistance. So when we try to implant in such a configuration that we showed in large animal study, when you get this graft and without corrugation, it's easy to kink. So it's easy to tell that this won't work. So that's why we didn't do this in vivo study, that analysis.
So did you have any occlusions of these grafts that you implanted in the sheep, these corrugated ones?
Yeah, corrugated graft is not 100%. Its patency is around 60 to the 80% range. So this tissue graft is better than the PTFE, but still not perfect.
Okay. And then do you think Dr. Dardick had a question in the chat about whether or not this sort of reinforcement could be added to other graft material, in fact, even biologic graft material, such as a saphenous vein or cephalic vein or something?
Yeah, that's a great idea. Yeah, it could be possible. I think it just matters of how you attach this suture reinforcement into this biological tissue. Because the biological tissue is really floppy, so they maintain some diameter and they're wrapping around this suture in kind of homogeneous ways maintain some structure. Can be a bit challenging in the manufacture, but that's a great idea.